Hello, I'm Stacy White, and today we'll talk about STDs and how to prevent them and how also to test. So, this is the herpes cell. Alright, so there's different types of STDs. The first one we have is chlamydia. In as little as 1 day, chlamydia may show up in your system, but testing should be done at least a few days after exposure. It's recommended you retest 2 weeks after treatment to make sure you are free of the infection. Next, we have gonorrhea. You can be tested for gonorrhea 6 days after possible exposure, and then again after treatment. Next, we have herpes. There's two types of herpes actually. You have oral and genital. Both are very common. You can be tested anytime after 6 weeks from the day of exposure. You can't cure herpes, but active flare-ups can be treated with medication. Next, we have hepatitis B. This disease takes 3 to 6 weeks to show up in your system. Most people don't show any symptoms of the infection until at least 3 months after the initial infection. There's no cure, so retesting isn't needed. Next, we have HIV. If you're infected with HIV, your body will try to fight off the infection by producing antibodies. The blood test for HIV detects the amount of these antibodies in your system. It takes 1 to 3 months for your body to produce these antibodies before testing to be accurate. It should be retested after positive tests because false positives can happen. Next, we have HPV. The most reliable test is a pap smear, which involves swabbing the cervix. This can detect HPV 3 weeks to a few months after exposure. Then we have syphilis. This STI can take up to 6 weeks after exposure to show up in lab testing. You will also need to retest 2 weeks after completed treatment. And then we have trichomoniasis. This is also incurable though. This takes a few weeks to test. So it's a few risk factors for STDs. So having a lot of partners, like having 3 or more like partners at the same time, can like increase it because you don't know who has the STI. Like anybody can have HIV, herpes at any time. Also, another one is inconsistent condom use. So let's say you go raw and a random sexual partner, right? There's a chance that she or he may have STI. The next is a breaking skin because remember, like infected blood can also give you an STI. And then next, the severity of the partner's infection. Like if, let's say, your partner has full-blown AIDS. If your partner has full-blown AIDS, then you're probably gonna catch that. So remember that. STDs in 2018, the prevalence. So 1 in 5 people in the U.S. have an STI. Nearly 68 million infections. So that means about 1 in 5 people you see in the grocery store, you see in the mall, in the street, anywhere can have an STI. So you want to be careful with that. So that's why it's important to test. So this is the amount of money that hospitals make off like treatment and cures and stuff like that. So HIV doesn't have a cure to it, but people treat it so it won't be active. So if somebody has sexual contact with a person with HIV, they won't catch it themselves. So they make $13.7 billion off this each year. For HPV, they make $755 million, and for all other STEs, they make $1.4 billion. So that's how big it is. Common reasons for STD reoccurrence. So taking the incorrect medication, like for HIV or herpes, that's not good for you. Taking medication incorrectly, like taking too much or too little, is gonna make it ineffective. Forgetting to make sure your partner gets treated, because let's say 2 partners have HIV, you can also make a super STD which can't be cured. And that's true. And then being exposed to a new STD, that's not gonna help either. So Remember that. So 1 in 5 people having STD, totaling near 68 million infections in 2018. 26 million new STDs in 2018. Almost half of the new STDs were among youth aged 15 to 24 in the U.S. So that's about the age most of us are in this room right now. So this is a little imagery, you know, how you can catch an STD. Yeah. And that's all. That's all.